This week's health question is, what causes a meniscus tear? And fortunately, we have experts here who will tell us.
So I guess the first question is, what is a meniscus? And that's,
probably
right. So there's cartilage in the end of the bones, and that's akin to the ends of the chicken bone if you're having chicken. Those are the two smooth pieces that allow the joint to move. But the meniscus is an additional piece of cartilage that decreases the force across the joint. And so these C-shaped, semilunar, or meniscus-shaped cartilages are in there as a shock absorber and as a stability mechanism. We see them very, very often, but typically it's a very high forceful bend or twist, and that causes the way the knee rolls. It rolls back on the tibia, and that traps the meniscus. And so people who fall, it could be even as subtle as stepping off the curb awkwardly, but it's usually some sort of bending and twisting combination. And afterwards, maybe you don't swell or bruise, but you'll notice that your knee's a little sore, and afterwards, every time you get into those deep bending or twisting movements, you'll feel a sharp pain that's usually relieved when you start walking straight. So a meniscus tear doesn't hurt all the time. It hurts when you get out of the car, when you climb upstairs, when you turn. And so we call that mechanical symptoms. So the joint itself still works. It's just if you put it in a certain position, the meniscus gets hurt.
You just sew that up as a repair?
Well, if it's a very small one, a lot of times we just trim out that tear. But if it's a large one, we try to repair it. But not every part of the meniscus can heal.
So it's great that you've outlined very nicely for us what to look for. So getting out of the car, certain movements of the knee, sharp pain would be an indication to come see your friendly orthopedic surgeon.
And that's all we have time for.
That's all we got.
So, Vicki,
if you have a question that you would like to ask Eric and myself on Health Talk, please contact us at healthtalk@norwalkhealth.org.